Hi everyone, Dr. Saurabh here. So today the quiz I'm ready to give is of retinal vascular diseases. 10 questions. Let us see the first one. Now first one is a simple question, very easy question, PYQ as well, recent question in NEET exam I think. Normal arteriovenous ratio at the optic disc is the lumen of the artery is narrower than the lumen of the vein. The ratio is 2 is to 3. In hypertension, it becomes 1 is to 3 because of arteriolar attenuation. That's the second question's first option. The lumen becomes narrow to 1 is to 3, which can compress the vein. Later on, 1 is to 4 can also develop, which can be retinal venous occlusion. So, hypertensive retinopathy, hard exudates, soft exudates, cotton wool spots are seen, but tractional detachment is not seen. In malignant hypertension, sometimes what can happen is exudative retinal detachment can occur because of outer blood retinal barrier break. More fluid can come from the choroid into subretinal space. Same goes for pregnancy as well. But tractional detachment occurs when there is a new vessels development in the retina, like a diabetic retinopathy, sickle cell retinopathy, and so on. Now, 54-year-old patient presents with sudden vision loss. Examination shows intraretinal hemorrhages exudates in all the quadrants. So, all the quadrants rules out C and D option because that is a branch. And in artery occlusion, there is edema in the initial stages, whereas in venous occlusion, there is all quadrants hemorrhages in CRVO, that is splash appearance, 1 is to 4 ratio, tortuous dilated veins are there, even neuruviosis iridis can be there, that is NVI, new vessels on the iris, which can lead to neovascular glaucoma, that is the pressure is high. So this is nothing but splash appearance, not a picture, not direct question, but a representation of the splash tomato, that is all quadrants, exudates, hemorrhages, that is CRVO. And the treatment of CRVO is primary treatment is pan retinal photocoagulation, secondary is anti-VEGF injection. I have given a question on that as well. Now, fovea is involved in Bull's maculopathy and in hypertensive retinopathy, macular star appearance, in cystoid macular edema like niacin toxicity. In chloroquine toxicity, there is a Bull's maculopathy, but CRAO has cherry red spot in which fovea is spared because maximum edema, initially edema occurs in ganglionic layer, that is maximum multi-layered in the macula. If you have seen the retinal anatomy quiz, sparing the fovea because fovea does not have ganglionic cells. So fovea is spared in cherry red spot, that is CRAO. Now, central retinal artery is a branch of ophthalmic artery. True, it's the first branch of ophthalmic artery. It enters 1 centimeter behind the optic disc and goes through the center of the optic nerve, enters the optic disc, and supplies the inner 6 layers of the retina. C option is correct. Even if you don't know about the B option, I also don't know. Just assume I don't know about the B option, but I know that the central retinal artery capillaries forms the inner blood retinal barrier. The outer barrier is formed by RPE layer, Brooks membrane complex. So B option is wrong. Actually, there is no anastomosis. It is the end artery. That is the wrong option and the correct answer. So this is a fundus picture of the right retina showing a blood. This red is blood. Now behind the blood, this I can't see anything in the retina. Means it has to be in front of the retina. So it cannot be intraretinal. Intraretinal are two types: flame shaped hemorrhages and dot blot. Splinter hemorrhage is nothing but flame hemorrhages at the optic disc seen in normal tension glaucoma. Subretinal means behind the retina. Now this is subhyaloid hemorrhage. Hyaloid you should know is vitreous. So it is a type of vitreous hemorrhage like a board shaped hemorrhage. That is the answer over here. That is a pre-retinal in front of the retina. This is vitreous hemorrhage, a particular type like a boat shape, that is subhyaloid hemorrhage. Ruling out the options, you can get the answer even if you don't know about this. Now, central artery occlusion patient presents with amaurosis fugax, that is transient blindness. Because if embolus can block the artery and can patient lead to transient blindness, And if you don't remove the embolus within 90 minutes, irreversible loss can occur. That's why you have to treat the patient in emergency by first thing ocular digital massage, then inhalation of carbogen, or decrease the pressure by mannitol or paracentesis. I told the answer of this. Pan retinal photocoagulation is a primary treatment of CRVO. Secondary can be anti-VEGF injections. Well, child with skeletal muscle weakness refer to eye department and chariot spot. The differentials of chariot spot, Buzzard-Nima is there, Tay-Sachs is there, Gaucher is a controversy, don't take it as, CRAO is there. But it's a pediatric question. So Berlin's edema and CRAO is not there. In Berlin's edema, there is a trauma history, blunt trauma history. In CRAO, I just told you there is a embolus history, maybe rheumatic heart disease, transient vision loss. So this is pediatric question. Skeletal muscle weakness is seen in Tay-Sachs disease. Gaucher is very rare cause of chariot spot. We don't take it. Biochemistry people don't take it. It's a controversy, so we also don't take it. Doesn't matter. But that does not have skeletal muscle weakness. So how to differentiate Tay-Sachs and Niemann-Pick? Both have skeletal muscle weakness, mental retardation, and chariot spot. That hepatosplenomegaly is seen in Niemann-Picks, not seen in Tay-Sachs. Now you will ask, sir, hepatosplenomegaly is not given. So Niemann-Pick is also not given in the option, na? So that's the answer. Tay-Sachs is the only answer over here. And all are going in favor of branch. Branch means one quadrant or part of the retina is involved. Rheumatic heart disease is history of artery occlusion. Embolus history is there. Retinal edema in particular area of the retina is there. Embolus blocking the artery. Please don't mind the spelling mistakes sometimes. But cherry red spot is central retinal artery occlusion. In branch, there will be patient presenting with visual field defects. In one quadrant, there will be edema of the retina in the inner six layers. Treatment investigation is same, but cherry red spot is seen when the central retinal artery is occluded, not branch. That's the 10 questions. I hope you have done well. Thanks for listening again. Best wishes.